Hi, Katie.
Hi, Amna. How you doing, Dr. Shabbir? Sorry. Should I call you?
It's okay. Amna's fine.
Okay. All right.
So we're doing this fun client Q&A today because I just graduated you from your coaching program with me, and I'm so proud of your progress. How do you feel about that?
I feel very proud of the work that I've put in through your guidance.
You're so kind. So I'm going to ask you some questions and double click on a little bit on our experience. I know that some other folks are curious to learn more what it is like to work with me. So before we started working together, what felt like the hardest or most stuck moment for you?
I had, at the time, I just opened my practice and I had a patient that I was spending 3 hours a day on the phone with. And I knew, like, for her, she needed that. But if I didn't figure out a way to not do that, I wouldn't be able to actually run my practice. And I needed help in creating boundaries to be able to provide the type of care that I want while taking care of myself.
I remember you being so overwhelmed with the boundaries. And also something else that was really striking when we started working together was a lot of the talk that surrounded self-criticism.
Yes. So I came to you for boundaries because I think there was a post on LinkedIn or something and I was like, "Yep, I need this." And I was surprised how much, I mean, obviously I work in mental health. I care a lot about mental health. I believe that we should have therapists. I'm always going to have my emotional support therapist. But I've said this to people, I've said this to my therapist, that I've had more improvement in my mental health with the things that I've gotten from you than I've had in years of therapy and working in mental health. And so I came in for boundaries, and it was like healing some of those child wounds and healing some of that self-criticism and looking at it. Sometimes I'll ask patients things in a way that you used to ask me, or I was like, to try and have them reflect on things. So it was, the boundaries was important, but that able to like see myself through a less critical lens was not something I was anticipating would be also involved in seeing you.
I am just so honored to hear you share that. It's so wonderful to hear that it was helpful in those very specific ways for you. And I so appreciate the fact that you've continued to also stay in touch with your mental health support, your therapist. Absolutely. What else was sort of like a surprise for you that was a byproduct of getting coached? I've had like all kinds of experiences from other clients, such as like, for example, I was not gaslighting them in this process. They felt like they had a lot of clarity even when it came to other domains of their life, not just work. Anything that stood out for you?
So I think we had talked about at the beginning about how since coaching isn't therapy, and I really didn't know I really had no idea what to expect. And I think some of the like the more direct conversations that like wouldn't happen in therapy where it was like I say this to patients all the time is like if like I remember that I hate the word resilient, talking about the word resilient and you stop and you're like, what about tenacious as fuck? And I'll use that with patients. I've told many patients that they're tenacious as fuck and they love it and they're like, this is great. So it was like it felt like like the sessions that I had were so helpful in creating, I mean, creating business ideas around marketing, which I didn't expect was something that we were going to do. Business ideas that were super successful and much easier than what I was doing. But it felt like talking to a friend that was like really good at everything that they do.
Oh, thank you. Thank you, Katie. I can see you getting emotional here, and I want to hold space for that. Yeah. 'Cause I've seen your tremendous growth. It has been such an honor to witness that, truly. I mean, I deeply, deeply mean that. That's what my role is. It's not to fix, it's not to advise, it's to hold up the mirror for you to witness your own greatness, to have the really tangible tools that you can use, and you've done that. Like, you are living proof. You've expanded your practice, you have set boundaries. We're recording this after your last session, and you were talking about so many things in such a completely badass way. I'm so proud of you. So that is definitely there. For anyone who's listening, because I get a lot of these questions and they're on the fence about investing in coaching or working with me, what would you wish that you would say to that person before starting? They're looking, they know they need help, but they're just hesitant.
So I would say that, like, it's the best decision that you'll ever make, and the investment in it is invaluable, and sometimes it's hard to, like, when we look at price and we look at time and we look at the commitment, and if we look at what the outcome is. I think I first started seeing you and, like, how much has changed, and how much, like, I'm able to kind of like, things happen and I can process it and I can handle it on my own. I can, like, adapt and overcome and make decisions that, like, before I used to have to get a lot of support from people and validation that I was making the right decision, and I have a lot more trust in myself in the things that I'm doing, and you can't really put a price on that, and so it's worth and, like, I'm sure there's other coaches out there, but, like, you're the one that I would recommend people to, because 'cause you're the one that I know is gonna be the best.
Thank you so much, Katie. I appreciate your time. We're gonna celebrate you.